In this room, there's a lot of equipment, and part of that equipment is endobronchial ultrasound. This is a wonderful piece of equipment that allows us to do staging of lung cancer. Staging is very important because the stage of the lung cancer is going to dictate treatment. This is a special scope that we have that has an ultrasound probe. We can place this inside the airways and it allows us to see most of the lymph nodes in the chest. After we see those lymph nodes on ultrasound guidance, we can actually biopsy those nodes with a needle. This is a non-surgical approach and allows us to gain very valuable information as to where the cancer may have spread in the lymph nodes of the chest. In addition to endobronchial ultrasound, we also have a technique called navigational bronchoscopy. This is a wonderful technique that allows us to extend the range of where the bronchoscope can go in the lung. Now there's hardly any location inside the chest that we can't go for purposes of either making a diagnosis where we can do biopsies, we can do brush biopsies and washings of materials. This gives us an accurate diagnosis of masses that maybe people thought could not be diagnosed before or may have required an invasive procedure with high risks, especially with patients who had underlying lung disease. Here at Southwestern Regional Medical Center in Tulsa, part of Cancer Treatment Centers of America, we have a new PET-CT scanner. This PET-CT scanner is very valuable to us because it helps us with diagnosis. It helps us to identify response to therapy and identifies new areas that may be important either to treat or to watch in terms of seeing what the response to future therapy can be. The nice thing about this PET-CT scanner is it's very sensitive. It can detect nodules as low as 3 millimeters, and concurrent with that, it has a special gating system. What gating is that it allows motion to be eliminated. So as the patient breathes and their chest moves in and out when they're breathing normally, it can take away that motion artifact and deliver clear, crisp pictures that allow for accurate diagnosis and management.